You've probably heard the term use it or lose it.
But have you ever considered what this means for your physical and cognitive health? Today we're going to look at how exercise can decrease the risk of dementia in older adults and how you can protect yourself as you age.
Let's start by defining dementia.
Dementia is a descriptive umbrella term for a group of diseases which are not part of normal aging but occur due to disturbance to the brain function. Alzheimer's disease is a condition which shrinks the brain by impairing synapses and killing brain cells. It is the leading cause of dementia, affecting up to 70% of all people with dementia. Vascular dementia is defined as a condition associated with impaired circulation of blood to the brain.
Other types of dementia include frontotemporal dementia, alcohol-related dementia, and HIV-associated dementia.
The symptoms of dementia vary a great deal. However, there are some common ones, such as loss of coordination, problems with memory, and personality changes. Dementia is the second leading cause of death in Australia, and there is no cure. There are currently more than 353,000 Australians living with dementia. Dementia is expected to become one of the major chronic health conditions of the 21st century. There is no cure for dementia, however, there are some treatment options. These include psychological therapy, general care and support, and medications that treat the early symptoms. Behavioural modifications, such as increased physical activity, may improve quality of life.
The risk of dementia increases as you age and is most common in the 70+ age group. It doesn't matter what age you are. Participation in physical activity is good for both your physical and cognitive health right across the lifespan. Exercise improves cerebral blood flow in the brain. It is thought an increase in cerebral blood flow enhances neurogenesis, which is the development of new nerve cells in an area of the brain important for learning and memory, the hippocampus. Exercise stimulates brain plasticity by directly affecting synaptic structure and by also strengthening the functions important for brain plasticity, including neurogenesis, metabolism, and vascular function. Exercise reduces vascular risk factors. For example, high total cholesterol is a vascular risk factor for dementia that can be decreased with exercise. A recent study showed that participation in 1 year of structured physical activity increased hippocampal volume by 2%. Those who participated in 1 year of stretching and toning saw a decrease in their hippocampal volume by 1.4%. These changes in hippocampal volume were found to be correlated with changes in memory performance, emphasising the importance of the phrase use it or lose it for older adults.
A recent study showed that for those already suffering from cognitive decline, participation in physical activity 3 times a week for approximately 30 minutes a day slowed the progression from cognitive decline to vascular dementia.
This evidence highlights that exercise is important for healthy older adults, but it's also important for those already experiencing cognitive decline.
Now that we've established that exercise is good for your brain, we had a chat to Beck from Peak Performance Personal Training about the overall benefits of exercise.
The main benefits of exercise for everybody exercising, not just the older people, are the benefits you get from mental and physical health. So the endorphins that are released when you're exercising that last for many hours afterwards, those feel-good endorphins, really important for your mental health, and of course the physical health, which is all the benefits that your body get from exercise. When I look at myself compared to other people in my age group, that having been active all my life, is showing through now. I say that to my children who are in their 30s, that the benefits you get from training when you're young pass on to when you're older, and that means your health is really good, you've developed good habits, you've got good neural pathways to exercise really well, and you know, if you do get sick, you can recover quickly. If you do go to hospital, you'll recover quickly, but you're less likely to be in that position if you do exercise all your life. And probably you need to eat pretty well, combined with a good, balanced and consistent exercise program. So the components of training well are cardiovascular exercise. So all that means is getting your heart rate elevated to get the benefits from doing it. Many years ago they talked about low heart rate exercise being of value, but we've found out since that that doesn't really help anybody. So you need to get your heart rate out of a comfortable training zone and hold it up a little bit higher and then drop it back down. Definitely strength work, and that's the sort of exercise you do lifting weights, and it gives you the functional strength. Flexibility, not just stretching, but that encompasses using weights again. It holds the muscles under load. Flexibility gives you the ability to move properly, to even drive your car and look at the car next to you, and using balance exercises for proprioception so that you know if you are going to have a tumble or a fall that you can put your hands out and save yourself from going down. Saves a lot of broken bones in the body, so probably those components.
The intensity and duration of physical activity required for cognitive protection is not yet agreed, but even just walking can be beneficial. Moderate aerobic exercise, which increases the heart rate to approximately 60% of the maximum for 30 minutes at least 3 or more times per week, is recommended. Resistance training is also beneficial.
Karen is 61 years old and regularly participates in physical activity. Today we had a chat to her about the benefits she's reported. Have you seen a physical or cognitive improvement since you're beginning exercise?
Yes, definitely a physical improvement. I've lost weight, I've gained muscle mass, and probably bone density is improved.
What is the importance of exercise to you?
The reason I have got back into exercise in a fairly intensive way is because I went back to riding horses when I turned 55. I'm 61 now, and if you're not in good shape, there's really not much point.
So do you feel being involved in physical activity has improved your overall quality of life?
Well, I definitely think it's an investment in the future. If you don't exercise, the older you get, things go downhill very quickly. So I think, yes, I physically feel a lot better, and I'm sure anything that helps your cognitive abilities is a plus.
Dementia is a common condition affecting older adults.
Behavioural modifications such as increased physical activity can reduce your risk of dementia.
Both resistance and aerobic training is beneficial.
About 30 minutes per day, 3 times a week, is recommended for cognitive protection.
Our message for anyone watching today is use it or lose it!